Hello guys and welcome back to my channel. My name is Tommy. I am a human nutrition student and researcher at the university. What I do in this type of videos is to synthesize the classes of the university and then I explain and teach you the best and most valuable information you need to know. Today we're going to continue the physiopathology series of videos and we're going to take a look at illness and immune responses and also the patient management. So let's begin. Etiology, the causes of disease, endogenous, exogenous, but also physical, chemical, and biological agents are present. These are all the agents that can get us sick. Physical ones: mechanical, concussion, cerebral concussion, contusion, a bruise, a wound with blood, of course, motion sickness, body swaying, dizziness, speed and acceleration, of course, in a roller coaster, for example, gravity, orthostatism, this is when you get up quickly from the couch, sedentary lifestyle, it will increase the cardiovascular diseases, and a prolonged stay in bed is also not good. Microgravity, cardiovascular muscular atrophy, bone decalcification, urolithiasis, and circadian rhythm alteration, as well as cancer. Dysbarisms, changes in pressure, absolute and relative hyperpressure, so a lot of pressure, blast wave and diving, absolute and relative hypopressure, altitude sickness, and air cabin decompensation in a plane. Vibrations, local or systemic, a rhinoid or a carpal tunnel. Noise pollution. Noise is considered a sound over 55 decibels, and the damage has to do with the intensity and the duration. Cold, hypothermia, when our body has less than 35 degrees, and it can be local or systemic, mainly in the fingers if it's local. It has two phases: the fighting phase, when you try to maintain the body heat and you start shaking and moving, and the second phase is the claudification phase, when the body gives in to the cold. Erythema, immersion foot, frostbite, necrosis indeed, and cholesteatoma. There is also heat, local or systemic. The first degree burns are in the skin, the second degree burns are in the dermis, and the third degree burns all layers of the skin. There can also happen a heat stroke when the temperature of the environment is over 40 degrees. Radiation, we have ionizing, the solar UVs, and the non-ionizing. The ionizing is cumulative and it can give us cancer. It can come from natural sources and also planned or emergency exposure to this radiation. And the damage can be external or internal. If you ingest something with ionizing radiation, then the damages are going to be internal. Solar UV, so ultraviolet light in severe burns, melanomas. Non-ionizing, mobile phones, microwaves and electromagnetic waves can also be etiological agents and can make people sick. Electricity, low voltage, few problems. Cut off the current and do not touch the electrocuted. If there is high voltage, many problems. Cut substation and try a resuscitation. Then we have the chemical ones. Intoxications, toxic is something that has harmful effects. Toxicology is the science that studies toxins. A toxin is a natural substance. A xenobiotic is a foreign substance. And the drug is a substance that modifies the body functions. The World Health Organization classification is this one: recreational use, alcohol, tobacco, cocaine, heroin and cannabis; natural, caffeine; endogenous, the most powerful ones, for example the DMT; exogenous, factories, food, junk food or ultra-processed; cooking materials using aluminum, also Teflon and heavy metals; plastic packaging. Be careful with that. PVC, which is number 3, polystyrene, number 6, and BPAs, number 7. Cosmetics and creams. Asbestos, phthalates, lead, cadmium, and additives are present in cosmetics and creams. Toxic additives in clothing. Dark colors, especially the ones coming from polyester, they contain heavy metals. Pollution. Air quality is the quality of life. So if the air is polluted, chances are you're going to get sick. Car air fresheners, they also have toxic chemicals, some of them. And pesticides in food, DDT, organophosphates and carbamates. And last but not least, we have biological. Microorganisms, viruses, bacteria, parasites and prions. Prions are misfolded proteins. Okay, so now let's take a look at the objectives of the clinic. The clinic is the science of the sick, and pathology is not the same as disease. The pathology is the way of falling ill, And that's what we study in this subject. Data collection is what we do. First thing is the anamnesis, where the patient tells us about the symptoms, and then we do a physical examination to get the signs. Then we check for a medical history and the anthropometric variation. Semiology is the study of symptoms and signs, indeed the study of syndromes, because symptoms and signs are syndromes. So these are the processes that we do. The diagnosis, which is what we've done here. Then we do a differential diagnosis to differentiate between diseases with similar symptoms. Then a prognosis, we create a prediction on the development of the disease, and then the treatment to cure, alleviate, or comfort if there is nothing else we can do. Now, immune system. So we have two types of immunity. The natural immunity, which is not specific, and the adaptive immunity, which is specific. The natural immunity first. There is no memory here. We have physical, chemical, cellular, and protein barriers. The levels of barriers are primary and secondary. The primary is the skin and mucosa, the sweat, the gastric acid, the eye drops, and the microbiota as well. The secondary are the macrophages and neutrophils that are activated when there is inflammation. Indeed, an infection can cause an inflammation, and inflammation will activate macrophages, natural killers, and neutrophils. The adaptive immunity has memory. It is specific. Antibodies and cellular lymphocytes immunity. We have the humoral response and the cellular response. The humoral one, macrophages, teach to the lymphocytes B about the pathogen, and then these create antibodies. The cellular response, the pathogen inside the cell, and the lymphocyte T recognizes the pathogen. But we can also use an inoculated lymphocyte T that already knows the pathogen, and this is what it has been done with many vaccines. Now let's take a look at the patient management. So stable patient first. Stable means that it is healthy, and health definition by the World Health Organization is the state of physical and social well-being. The levels of prevention are primary, secondary, and tertiary. The primary, you prevent the occurrence of the disease. The secondary, you treat the early stages. And the tertiary, you slow down the aggravation. The prevention of cardiovascular disease is by dealing with the risk factors, which are high blood pressure over 140/90, the diabetes mellitus, and this is its diagnosis, obesity and smoking, hypercholesterolemia, the alcohol consumption as well. Here we have the standard basic units, and we classify it as low risk when there are less than 3 and less than 2 standard basic units consumed per day in men and women, moderate risk above 3 and 2, and high risk over 6 and 5, or 40 weekly and 28 weekly for men and women respectively. Then also we have to take a look at the sedentary lifestyle, and we have to recommend 150 minutes of moderate aerobic activity per week, together with strength and flexibility exercises. And here comes the thing of MET, which is the metabolic equivalent of task, to check indeed the physical activity levels. Now the management of the critically ill patient. So this is an extreme deterioration of the vital function, with irreparable organic sequelae and even death. The complications are sepsis, thrombosis, ulcers, anemia, malnutrition, and also renal failure. Here we have the shock. Categories of shock, we have seen this. Cardiogenic shock, which is an impaired contractility. Hypovolemic, a decreased preload. Obstructive shock, preload obstruction of venous return. And the distributive one, which is a decreased systemic vascular resistance, causing vasodilation. If the cardiac output is decreased, we have to assess extracellular volume, the dehydration, and the cardiac function. If it is increased, we have to decrease the vascular resistance. Acute respiratory failure. Here, when the arterial pressure of oxygen is below 60 millimeters of mercurium. When it is not severe, we opt for a resolution of predisposing disease. When it is severe, we have to make an orotracheal intubation and assisted ventilation, this thing right here. And we categorize it as partial hypoxia, when only the pressure of oxygen is below the ranges, lower than 60, and global when we also have hypercapnia, so high CO2. Now, severe sepsis. So sepsis can be a lethal entity if not suspected and treated intensively and early. It can be acquired outside the ICU, but also, the majority of the cases, it is acquired inside the ICU, intensive care unit. The sepsis is the leading cause of death in non-coronary ICU, and this is due because of frequent multi-resistant germs in invasive interactions, such as intubations, probes, catheters. Here we have the diagnosis using the quick SOFA. If you remember it, is hypotension, so a blood pressure below 100 millimeters of mercurium, an altered mental status, and a tachypnea over 22 respirations per minute. The treatment is with antibiotics, assisted respiration, nutrition, protection, and also water and electrolyte replenishment. Now the cardiovascular collapse. We have the cardiac arrest and the sudden death. The cardiac arrest is the sudden reversible interruption of pump function, so reversible. The sudden death is irreversible. The causes: the ischemic heart disease or severe arrhythmias, a ventricular fibrillation, for example. And here we have the basic life support and the advanced life support. We have to follow these guidelines to check if everything is okay. The majority of the times we have to learn properly the basic one, and you should all know a little bit about this. So, dangers. Are any dangers? Is he or she responsive? Send for help. Open the airway. Normal breathing. Start the CPR. 30 compressions and 2 breaths. Attach the defibrillator as soon as available and follow prompts. Make sure to also continue the CPR until responsiveness or normal breathing returns. And last but not least, we have acute confusional states and coma. The acute confusional states are basically altered levels of consciousness, fluctuating with acute onset and inattention. The causes are many: sepsis, intracranial pathologies, convulsions, hypoxia, hypersensitive crisis, shock, metabolic disorders, hypovitaminosis and electrolyte disorders, but also drugs, such as sedatives and analgesics, and also a drug withdrawal. On the other hand, the coma is a pathological state of reactivity. The patient does not wake up. In relation to the central nervous system, it can be due to a trauma, infections, epilepsy, hemorrhages, or cerebral edemas. Not related to the central nervous system, drugs, hypoxia, hypercapnia, hepatic or renal insufficiency, as well as electrolyte disturbances. The clinical depends on the cause of the altered level of consciousness, and the treatment the one of the disease causing it. Okay, so that's it for this video. I hope you understood everything I said, and if you didn't, there is a comment section down below. Remember to download this diagram by clicking the first link in the description. Don't forget to like, subscribe, and turn on the notifications, as well as to share this video if you find it helpful. Thank you so much for watching, and I will see you in the next one. Ciao!